Hey, I'm here to celebrate the publication of my new book, The Brainbow Blueprint, and I've already got some great questions from all of you. So let's just jump right in and answer some of those questions. And whatever comes up, just send them in the chat. And you'll see here in the upper left-hand side a Q code if you decide to buy the book. That's an easy way to do it. So let's get going with that first question. What is the Brainbow Blueprint? You know, I'm a psychotherapist who's been in practice for over 40 years. And over time, like many of you, I have learned so many different methods of meditation and yoga and exercise, and of course, good food for a good mood. Uh, Learned about psychedelic medicine, hydrotherapy, really began to integrate many years ago into my psychotherapy practice a variety of modalities. And as I worked, I realized that I had 17 different major modalities and major aspects of what I thought was essential for whole health for my clients who were coming to me for depression, anxiety, post traumatic stress, OCD, insomnia, you name it. So over time, I developed the Brainbow Blueprint, which is really a roadmap to integrative health and well-being for both mental and physical well-being. So that's a little bit about the Brainbow. Next question. Why is a holistic approach so important when treating clients' mental health? Isn't that true? Well, even though I began as a psychotherapist, before I did psychotherapy, I began as a body worker and a somatic therapist. So I began with the body. And as people started telling me about the pain that they held in their body, they told me about their painful stories. And that took me to the study of the mind. And even though traditionally we tend to separate mind and body, I think increasingly we're reintegrating that treatment. And I feel that our clients are whole people. They do bring their physical and their mental distress to us. And so a holistic approach that responds to them, I find we are on the vanguard of responding to their physical and mental health in ways that their other providers are not. We have a way to help them think of themselves holistically when we assess and treat them that way. So that's why I think where it begins with its importance. Next question. And I'm seeing a few notes here from Jessica. Hello. What is bioindividuality and what role should it play in mental health treatment? Bioindividuality is the number one spot of the Brainbow Blueprint. And I put it there because it reminds us to treat each person as an individual and recognize that every one of us is quite different. We can dig down into our genes and the ways our genes are different and how differences in our genomic factors can affect our mental health. But those genes also affect the kinds of foods we eat, the kinds of illnesses we're more vulnerable to experience. And I've got a saying that goes along with the bioindividuality, which is there's no one right diet for everyone or anyone, because the big myth is that there's one diet to follow that will bring you physical health and mental health. That's what everyone's focused on. The latest fad. Is it keto? Is it vegan? Is it paleo? And the fact is, everyone's an individual. And in therapy, we treat people as individuals. So we have to bring that bioindividuality to the kinds of exercise we recommend and the kinds of nutritional interventions we recommend. So bioindividuality is the top for that reason. Do you have a favorite chapter or section from the Brainbow Blueprint? That's like asking me if I favor one of my children. I love all of my chapters equally, and it's very hard to pick out a favorite one. But if I had to, I would choose the assessment chapter because I think everything we do and the success of what we do, especially in integrative health work and nutritional work and wellness work, has to begin with a really good assessment. Because if we don't have a good idea about what's going on with someone and dig deeply into those weeds, then we're going to go off on a lane that may not bring the results we're looking for with our clients. And I'm passionate about those of us who are trained in mental health, really strengthening our physical health muscle, really strengthening what we know about digestion and about how someone's doing with their movement or their somatics. And likewise, if you're trained in physical health and in rehab, then I think there's a value to understanding the language of mental health. So that's why I think assessment might be my number one favorite child. If there was one nutritional supplement that you'd recommend most people to try, what would it be and why? Well, I think for anyone living above the 38th parallel, and you're talking Arizona level, most people are going to be deficient in vitamin D. And vitamin D is essential for as an antidepressant, anti-pain, and to support immune health. And even in some European countries, there are public health initiatives to supply the population with vitamin D drops during the winter, especially just to maintain good mood, good immune function, and keep pain at bay. So I think vitamin D, if you'll pardon the pun, is a no brainer. It is absolutely essential. And what I recommend all my clients do is get a blood test every year, measure their vitamin D levels. And what you'll notice in the laboratory is that the lab will give you some lower numbers that are acceptable. But in functional health, in holistic health, in integrative approaches, we favor an optimized level of vitamin D that begins at around 50, 60, even 70 nanograms per milliliter. So keep that in mind, vitamin D. But I would be remiss if I didn't respond and give you one more. Your omega 3 fatty acids. There's superb research behind the use of omega 3 fatty acids for depression, anxiety, and pain. So there's just a little nugget as you begin to explore the Brainbow Blueprint nutrition chapter. All right, let's see this question. If you can move the private chat, there we go. I can see the question about, there we go. I've heard there are some tasty culinary medicine recipes in the book. Can you share your favorite? Well, I love barbecue sauce, but I don't do well with a lot of tomatoes. And so I created a pineapple, onion, papaya barbecue sauce. And I love barbecue sauce whether I'm eating, if I'm in a carnivore mode, if I'm going to put it on meat, or if I'm in a veggie mode and I'm going to smother tofu in a healthy barbecue sauce. Many of my clients don't do well with some of the tomatoes or some of what we call the nightshades. And I write quite a bit about this because the nightshades can create joint pain in people who are sensitive. So I always want to come up with recipes that give substitutions for a lot of the dishes that we love. What you'll notice is in the principle of substitutions, which I talk about in my book, it's not that you can't enjoy sweet foods, you can't enjoy barbecue sauce, or even potatoes or nightshades too. I've got another recipe about jicama fries, which substitute potatoes for jicama. So the idea is that we can still be so satisfied and feel satiated by eating foods that are just substitutes for those that we love. So check out my pineapple, onion, papaya barbecue sauce. I think you'll love it. All right, let's take a few questions I see on the right-hand side. Jessica, hi. Where did you get your PhD? Thank you for asking. I got my PhD in behavioral medicine at the Union Institute and University. And I also was very fortunate to get my first master's degree in cross-cultural health psychology at Lesley University in Cambridge, followed by my master's in public health from Harvard Medical School. So I've had the opportunity to have a foot in all worlds of academia, which has really nourished me. So thanks, Jessica, for that question. And if you're interested in your PhD, I always love hearing from you and making recommendations for wonderful programs that are out there. Stacy, how would you treat a client with colonic myopathic dysmotility when the doctors are recommending daily laxative use? Great question, Tracy. I'm a big fan of visceral manipulation. I do a lot of work with people with this problem, particularly associated with diabetic neuropathy. And I find that visceral manipulation, and I bet from your question, you may be on the rehab and the physical side of health. I think finding a good physical therapist who's trained in visceral manipulation can help restore peristalsis, can help restore connection between the vagal nerve and the phrenic nerve of the diaphragm through breathing and through reestablishing nervous system function to the musculature of the colon and the small intestine as well. So thank you. Now, one more thing, and I'm not saying this is appropriate for your client, Stacy, but other modalities that I teach about in the Brainbow are coffee enemas. Coffee enemas used to be in the Merck manual, and they continue to be used, even though they're used mainly for liver health and phase 2 detoxification. They do address constipation. There are also gentler laxatives, certainly lots of fibers, but you have to be very careful where motility is the issue. Um, and Stacy, that's just a very brief answer to a very complex question. Thank you for raising it. Jenny, what role does spirituality play in our whole body wellness? Well, it's part of the Brainbow Blueprint. My approach is I let my clients know that I'm interested in spirituality. I have a spiritual practice, and that if they want to talk about spirituality, I am open to it. And I'm very familiar. One of my postgraduate fellowships was in psychology and religion in the Department of Psychiatry at Harvard Medical School. So I have a keen appreciation for spirituality, religion, mental health. My approach, especially because I work with a lot of trauma survivors, there's nothing quicker to really crush spirituality, hope, purpose, religious belief than the traumatic experience. And so this comes up a lot in my clinical work. So I think it's an essential part. However, I may work with people for whom religion or spirituality is non existent. And they may say, they may not even bring it up, or they may say, I'm not interested. And I totally respect that. Indeed, I totally respect people who identify as atheists, which interestingly enough is quite stigmatized in our society. So I try to create a very open, welcoming envelope for everyone and to really understand how we make meaning and purpose out of often the distress and the mental challenges that we have in our lives. Thanks for that question, Jenny. Jessica, all right, will you drop me an email and we'll go from there if you're interested. And Kate, hi, nice to see you again, Kate. What are 3 supplements you recommend as a starting point for overall health? Well, we start with vitamin D levels. Let's optimize those. Let's optimize your omega-3 fatty acids. And you can order a test online to test your omega-3 fatty acids. And I give you the information in the Brainbow Blueprint. I give it to you in my certification courses as well. And I'll share with you, you can go on to Omega Quant, and I don't have any affiliate status with them, so I won't make any money from this recommendation. And you can order a test to be sent to your home. It's a little blood spot, and they will give you a readout on your omega-3 fatty acid levels. And then you can read how much fish should you be eating, or how much algae, or how much fish oil supplements or algae oil supplements, if you're a vegan, how much you should be taking. The research is very clear. It's anti-inflammatory, it's an antidepressant, it's anti-anxiety. So that's the first two. Now, what would be the third? I think folate. I think a B vitamin complex or even a simple methylfolate is going to be helpful for most of our clients, who, many of whom I would say predominantly are depressed and anxious. That's who I'm working with trauma, PTSD, lot of OCD, a lot of bipolar as well. A lot of what gets misdiagnosed is borderline, that's really complex trauma. I begin with those three, and then we go from there. And the good thing about those three is you can't really make a mistake with those three, meaning that's what I call our beginner supplements, where just like you're working with people as you're beginning down this path of the Brainbow Blueprint, you don't need to be an expert yet. You can begin with vitamin D, begin with your omega-3s. Now, there are some caveats. If your client is on a blood thinner, you don't want to give them too much. That's why it's important to take a course or read a book or get some training. Thanks, Kate. Good luck. And thank you, Jessica. And hello, I'm seeing G. Panzerable. Hi, what's your advice for clients who want to work on many areas of their health and are feeling overwhelmed, especially those with chronic pain and illness? Which areas to start with? Such a good question. And, even my advanced students who come to our post certification courses are always asking this question. That's the key to the art of what we do. And so I can tell you're really at a high level of clinical artistry, because we can know a lot of things to do, but where do we begin? One of the first places I make that decision is with my client. Where do you want to begin? Where do you feel that you will pay attention and flex that self-care muscle consistently? We have a saying in exercise that the best exercise is the one you'll actually do. And so, in this sense, I always get buy-in with my clients. We work collaboratively to identify, is it nutrition where we'll start? Do we start with movement? Do we start with getting a nice visceral manipulation or massage or foot reflexology? What's our goal? And I always, in my intake forms, which I include in the Brainbow Blueprint book, ask the question, what are your goals? And we identify them for 3, 6, 9, and 12 months. And thereby, we keep checking in around goals. Are we meeting our goals? Do we need to switch and change things up? So it really depends. Now, you've named chronic pain and illness. So with chronic pain, I think about anti-inflammatories. So I might start with reducing pain. And one of the best ways to do that, if you're not familiar with a drink called golden milk, it's a delicious recipe that includes turmeric or curcumin, the active substance of golden milk. And it has some other ingredients in it, ashwagandha, which helps relax and calm the system. And it's such a potent anti-inflammatory that just beginning day by day, getting inflammatory process down. Now, there are lots of other things that we might do, but I begin slowly and go step by step with my clients at the pace that they're able to. So thanks for that question. If you're interested in exploring more, the book has lots on inflammation and pain, but so does my training as well. So feel free to access those resources. All right. Well, thank you, everybody. So nice to see you. Thank you for taking time out of your day. And thank you to Pessy for hosting me and for our illustrious techno team. And I'll be back. I'll do some more of these over the next month. So come join me. And in the meantime, check out the book, check out the courses. And until then, I'm sending you my very best.